Hi, so I want to welcome everyone to our webinar that is going to focus on the mini grant projects that are a part of the Epilepsy Foundation CDC Cooperative Agreement. This is the second year of us having this funding and having this round of mini grants that focus on social determinants of health. I am Tometta Cozart. I serve as the Multicultural Outreach and Health Equity Director for the Epilepsy Foundation, and I want to welcome everyone to this particular webinar. We're going to go to the housekeeping next. So I want to make sure everyone knows that this particular webinar is being recorded. We will be sending the link out to several of our partners and colleagues who are not able to join us today. Everyone has been muted. All of our grantees who are panelists, please also keep yourself muted until it's your time to speak. If you do have a question, we do have the question and answer function open. We are going to hold all questions until the end of everyone's presentation. So thus, if your question is directed to one particular grantee and that grantee has to leave early, they still will be able to see your question. We will still be able to get you an answer. Also, if you can put where you're located and your organization in the chat, in the question and answer with your question, then that again can make sure you get an answer just in case your person has already left. Again, we want to make sure that everyone knows that we are in webinar mode, and so you will only see those who are speaking. And then if you have to have a concern around bandwidth or connectivity, you are more than welcome to cut your camera off until it is your time to speak. If you are going to share audio of any kind as a part of your presentation, please make sure you are sharing that function as a part of your computer when you are unmuted so that everyone can hear. Okay, so if we can go to the next slide. So I want to just remind everyone about our mini grant project and what the intended outcomes were. So for the last 6 months or so, our mini grants have been focused on addressing epilepsy disparities that are in rural areas of their state. They were asked to engage workforce that had to do specifically with rural health, so community health workers, rural providers, and then also being able to address the aspect of digital inequities by engaging digital inclusion specialists and being able to address the digital divide when it comes to the aspect of being in more rural areas. Each of the projects were awarded $10,000, and then their intended outcomes, of course, was to be able to really do outreach in more diverse and underserved populations, specifically focusing on rural areas. We were also asking them to, again, focus on those populations that had expertise and inroads into those communities already. And then ultimately, we were trying to increase linkages between those who are living with epilepsy in those areas and not just epilepsy services, but also some of the social needs that may have gone unmet in the past, such as being able to address the aspect of not having equitable access to broadband to be able to use telehealth services and other things like that. So the Epilepsy Foundation at the national level had monthly meetings with each of the grantees. We provided them with technical assistance by connecting them with our CDC project officer, with resources at the national, regional, and local levels, by connecting them with our national partners, existing resources, but then also finding new resources for them to be able to do a better job in implementing some of these social determinants of health strategies, even beyond the grant. So we're going to be able to hear from each of them. Some of their projects are ongoing. So these are preliminary results that you will hear. Many of them are still going to be working on activities all the way up until September. So these are not final numbers. And we have given them very limited time to be able to present. So you're only going to hear a snippet of what they've been able to do over the course of these 6 months. Okay, so we can go to the next slide. So this is the order in which you will hear the mini grants. Again, some of them do have to drop off after they present. So if you are looking to engage with one particular group and you are unable to be able to do that on this webinar, please do let me know and I will make sure that I connect you with them directly. Or if you're able to contact them in the chat now that that function is open, you are more than welcome to do that as well. But please remember, all questions will be held until the end. Okay, so we're going to go ahead and get started with our first grantee. Beth, you are up.
Yes, Tamara, so I am going to be sharing sound or audio, and I don't know how to quite connect that. I've just got it hooked up to a Bluetooth speaker that I'm going to hold up. Hopefully everybody can hear it. Is that okay before I get started?
Hopefully, yes, but we'll see.
Okay,
We'll let you
I'm
know if
praying.
we can't hear you.
I'm praying. I've got it turned up as loud as it'll go. So hopefully it won't blast everyone's eardrums out or you can hear it. So, okay, well, I am ready to go. My name is Beth Stivers. I'm the executive director of the Epilepsy Foundation of Kentuckiana. We have been working on our project now. We do have our project is one of those that's ongoing. So do you want to go ahead and move forward to the next slide, please? Okay, so our project has been multifaceted in trying to reach minority groups as well as those living in rural areas through different projects. The first one that we had was we wanted to directly serve 250 individuals through our seizure first aid certification training programs on Zoom. We also offered training programs to specific groups that they could do in private as well on Zoom or in person. We wanted to do a CME program and then also exhibitions as well. So far we have provided 6 programs via Zoom for the general public. We provided for a group in Owensboro, which is a rural area, for a group called Pause for Jonah. We did work with our AHEC partners. We worked to do the Northwest AHEC Junior Scholars HealthWise program. And we also did the Purchase Area Development District Summer Campers in Paducah. And then we did all of the bus drivers and monitors in Knott County Public Schools as well. We exhibited at 2 senior health fairs in rural areas in Western Kentucky. And through all of those programs, we have reached 257 people. So we at least met our goal, which we're happy about. And we still have programs scheduled and we're still soliciting for programs through the end of the month. So hopefully those numbers will go up by the time we do our final report. We are still working, unfortunately, on our CME program, the hashtag epilepsy equity and the treatment of epilepsy in African American and rural populations. This is something that will probably not happen until later this fall. It's just our panelists have not been easy to get scheduled and pinned down. So we're still working diligently to make that happen. And we plan to do that at least before the end of the year. And then we also have 2 more programs scheduled on Zoom for the general public. And then we will be exhibiting at a public library community health fair as well before the end of the month. So like I said, our biggest challenge has been the CME program for this. It was our challenge when we tried this for our last granting cycle. But this time we're really hoping we can make it happen. But it has been a little bit of a headache, but I think all told, we're still reaching good numbers and we're pleased with what we have done so far. So next slide. So we also have worked to raise awareness for epilepsy for over 18.3 million individuals through radio PSAs, paid Facebook advertising campaign, and other social media messages. We have been working with our partner media venue has gotten us a contract with Kentucky Sports Radio Network. And I've mentioned it before, but Matt Jones is one of the leaders of the Kentucky Sports Radio Network, and he also has epilepsy. We have tried for years to get him connected to the foundation. He's kind of quiet about his epilepsy, but I do feel like he's becoming more vocal as time goes on. Those are in progress at the moment. And before I finished my presentation, I'm going to play the first live read that he did, and it really thrilled us all because he actually made it personal and kind of gave his 2 cents, which is what we were hoping he would do instead of just reading the script that we sent him. He also recorded a 30-second ad that's being played, and those campaigns are for 6 weeks, and the live reads are 1 read a week, and then the messages are playing across the sports radio network as time permits through the end of August. So we will have our final numbers at the end of August for our final report, but so far we are just just thrilled that this partnership has worked out, and I think it's going to reach a lot of people. I've had people that do listen to Kentucky Sports Radio that have a podcast, and they also do it live. And I've had people reaching out to me saying they heard it, that they were really excited for us. So I know people are hearing it, so that makes us really happy. Also, we've been working to strengthen and build our partnerships with our community agencies to further outreach to African Americans, as well as those living in rural areas throughout Kentucky and Southern Indiana. We did get letters of support from the Southern Kentucky and Northwest Kentucky AHECs, and they have been great to work with. They have shared information about our programs with the rest of the AHECs in the area. We're hoping to maybe have more programs before the end of the granting period with them. But we've also been working with the community health workers. We have access to the database. So we were able, and I know that we sent out a newsletter to the Community Health Workers Associations about our grant messaging and our programming that we have available. We also joined the Kentucky Rural Health Association. We put an ad in their newsletter. And then the Library Association, we have access to their listserv. So through our grant messaging sent to partner newsletters, which included our PSA messaging as well, we have reached about 1,285 through that. And then we also have 44 libraries that are wanting to put up signage, as well as a book that we provide to clients to be able to get access to that too. So we'll give books to the libraries to check out. And then as supplies are limited, we will be able to give books to some of people that call in to first come, first serve, but we are planning to do that. So overall, we're super excited about our program. We feel like we've met up most of our goals at this point. But before I finish talking or take questions, I am going to go ahead and try to play this live read for you, because I'm excited about it and I want you all to hear it. So hold on just one second.
I will do this read. In the heart of Kentucky, the Kentucky Epilepsy Foundation is doing work. I didn't know once I ended up with epilepsy, I learned this. 1 out of 26 people develop epilepsy during their lifetime. That means there's 175,000 people in Kentucky with epilepsy. I'm one of them. But despite this prevalence, people with uncontrolled seizures sometimes don't even go see a specialist. I do, and you should too. In Kentucky, there are 4 epilepsy centers offering cutting-edge resources. You can learn more at the Epilepsy Foundation of Kentuckiana, EFKY.org. EFKY.org. Since I've talked about mine, I've had many of you reach out to me and say, my kid just had this. What should I do? I have a family member who's had it. EFKY.org has the resources to help you if a situation like that happens in your family. Together, we can end epilepsy. It's the Epilepsy Foundation of Kentucky. We'll take a break and be right back. Stay us up.
Let's talk to Matt, Joan.
I hope did everybody hear that? Or did I just, okay, good.
No, that was wonderful.
Thank you. So yeah, there will be however many weeks left. I think there's 3 or 4 more reads to be done still throughout the end of August. So we're super excited, and I know he will probably add a little more anecdotes as he goes on, but we're glad that he's at least talking about his epilepsy and connecting that to us through this program. So thank you so much for this funding. I think it's really gone a long way to help us reach the rural population and minority populations. So thank you all. Anybody have any questions?
Beth, we're going to hold questions to the end, and we're going to
mind.
go over to Kim, but thank you so much.
That's fine. I do have to hop off just before the end. So if anybody has any questions, just reach out to Tametta and I'll be happy to talk to you. Thanks.
Hi, has Kim Hardy been able to join us? Or is anyone from her board on the call now? Okay, I do not see Kim on, so we're going to go ahead and go to the next grantee. And that would be Jill Dent with Minnesota. Are you on, Jill?
I
Yes.
am, yes. Can you hear me?
Yes.
Great. Wonderful. Hi, I'm Jill Dent. I'm the grants manager for the Epilepsy Foundation in Minnesota. We were really excited to have the opportunity to focus this year on connecting rural residents with epilepsy. Will you bring up the first slide, please? So our first outcome that we were striving for was to increase the number of people with epilepsy from rural Minnesota who are connected to us and local services. So our strategy to do that is that we are creating referral partnerships with 2 healthcare systems that are primarily serving rural Minnesotans. We created a partnership with CentraCare Health Systems, which has locations throughout greater Minnesota. And then we created a partnership with Gillette Children's Specialty Healthcare, and about half of their patients are residents of rural Minnesota. So to develop these partnerships, we created the referral process. We had to figure out how are they actually going to get the information about the patients that they think would benefit from EFMN support. How are we going to get the information from the clinic directly to us? We trained their healthcare providers and their staff on who we are. What are the epilepsy inequities that rural Minnesotans are facing, and what we can do to support their social determinants of health. We created marketing materials for each partner. So sometimes that's digital ads that are displaying in their waiting rooms, or brochures that their provider can hand to their patients when they're talking about EFMN. And then making sure that we're compliant with HIPAA by having business associates agreements and memorandums of understanding. Kind of the biggest lesson that we've learned through creating these partnerships is that each healthcare system has its own unique culture and flavor and processes and systems. And so it's not a one-size-fits-all approach. For example, CentraCare Health Systems, we've created a special HIPAA secure patient referral form that their providers will fill out to send the information about their patient that they'd like EFMN to support directly to us. But Gillette Children's Specialty Healthcare, they're using an existing platform, the Unite Us platform, to send their referrals. And so as we look to figure out how we can create partnerships with healthcare systems, kind of our biggest lessons learned is that each partnership does have to kind of be based on what each healthcare system is able to provide and their unique kind of structure and services and culture. Next slide, please. Thank you. The next thing that we wanted to do was to increase the epilepsy knowledge among healthcare providers in rural Minnesota. Our planned strategy to do that was to present on rural-related epilepsy inequities at the 2023 Minnesota Rural Health Conference. Unfortunately, our team wasn't invited to present, but what we did is we exhibited, and that actually created a lot of really great opportunities for our team to talk to rural healthcare providers when they stopped by our table. So 2 members of our team attended the conference, and then we had, every time there wasn't a session, the members of our team were at a table where we were sharing information about EFMN, we were sharing information about epilepsy inequities and kind of what we can do to support their patients and their clients. And then our second strategy for this was just training healthcare providers that are serving rural Minnesotans in understanding what it is that we do here at AFMN. We trained 23 different providers through 2 different trainings. We talked about epilepsy inequities. We talked about the services that we can provide their patients. And one of the biggest kind of surprises of this is that there were healthcare providers that have been volunteers of ours and active advocates of ours for years who came away from those trainings saying, I didn't actually understand the scope of the work that you were doing. Like, I knew that you were around and I knew you supported people with epilepsy. And we knew that you had camps, but I didn't realize you were doing this much in-depth work for people with epilepsy. And so that really opened our eyes to opportunities to do more provider training to really help make sure that they are the people who are connecting their patients to us. That's my summary. I look forward to any questions at the end of the presentations.
Thank you so much, Jill. Before we go on to Liz, I just want to make sure that we have not had Kim join us before we get too far away from her presentation. Okay, and I see she has joined. So I'm going to add Kim as a panelist. If you can go back to her slides, please. Okay, Kim, you can unmute and you start your presentation.
Okay. Sorry for I'm late, but my name is Kim Hardy. I'm from the Hardy Hands Foundation. We are located in Columbia, South Carolina. We did our presentation. Our goal for our mission rather is to educate, advocate, and teach and support those living with epilepsy. This fight is all ours, and we are in it to become stronger and more aware of what epilepsy is and what it looks like and the importance of support. One cause, one fight. Our goal and our objective was to reach 4 rural areas in South Carolina: Orangeburg, Fairfield County, Richland County, and Kershaw County. We did a rural county vendor campaign. We created partnerships with other organizations within the community. We did media advertising, interviews, and we're starting a podcast. We did epilepsy first aid training. Epilepsy, we got our board and our board members epilepsy first aid certified, and a couple of us are epilepsy first aid certified to train. Our overall project review is we successfully reached out to all 4 of our rural areas. We made connections in those areas during these vendor events. We made a connection in Fairfield County during the Blair Day Pride event, parade event, excuse me, with Senator Mike Fanning, who got us, who has connected us to the Chester County area. We are now been invited to do a event with them in October. We made him aware of what we're doing and our goals as far as getting people epilepsy first aid certified, what epilepsy and seizures are. He connected us to the Fairfield County School District so that we can also let the teachers and the nursing staff and administration get for epilepsy first aid certified. So we're working on setting those dates up. We had events in Columbia. We did Richland County rather, where we did Stomp Out Crime, where we were a major sponsor for that. We reached that day 250 people, and there were 500 people there. We reached about half of those people. And we also did a community health fair in Orangeburg, where we reached a good 45 to 50 people that were there, and most of them were educators. So who are inviting us back to do another health fair in September. With Kershaw County, we went to the libraries, and we did a book where they had a book reading where I read The Adventures of Kimmy and Wally, talked to some of the kids there about what epilepsy and seizures were. There was about 15 kids there and about 6 or 7 parents there. We also did just partnered with different organizations such as Project Jasmine, Hush No More, and there was one more organization we partnered with. We started working with the domestic violence community because, you know, we've had a lot of people that work with us that have gotten epilepsy or seizures through domestic violence incidents. So it was important for us to make the domestic violence community aware about what to do if this does happen to you. You have resources, and give them the resources to know where to go. We were invited onto Soda City Live, which is a local community news show. that comes on at 3 o'clock here on WIS, which is a major television network. And we let them know what Hearty Hands was, what we were doing, and how to get out to the community, and about an upcoming event that we have going on that I'll tell you about in just a minute. We did a billboard advertisement for the current event that we have coming on, which is the back to school bash and butterfly release that will be happening next Saturday, where we're releasing butterflies in honor of the kids that have epilepsy. We managed to reach a total of 442 people through this, and our takeaway was that there's still a lot of work to do in the Black and Brown community, and that although now that they know that we're here, we're able to help and assist them. And that's all I have.
Thank you so much, Kim. We also want to highlight the fact that while we have Shell advance the slides to go on to Liz's presentation, that you also are considering our invitation to become part of our board for South Carolina with a part of our regional team. So we're really excited to have you be a part of our new family. And we're really excited about the work that you've been able to do in South Carolina. So, all right, we're going to go on to Liz so that we can hear about the activities that have occurred in Louisiana.
Thank you. Hi, good afternoon. I am the Chief Learning Officer for Southeast Louisiana Area Health Education Center, formerly known as AHEC, in the state of Louisiana. I cover the 13 parishes of the state. Next slide, please. Thank you. So our objectives for this grant was to provide a CE offering on epilepsy, which we did. We completed and had over 149 registered, and 65 of those registered nurses did receive certificates of CEs, and the goal was 20. So we completed that. Next, we partnered with local organizations like Saving Grace Epilepsy in New Orleans. It was a great organization where we reached over 5,000 individuals at the Essence Festival, and we were able to have a booth there with her. We coordinated that. She provided a Jenga game, which was a hit at the Essence Festival, just give inspiration on the blocks, and they wanted to take the blocks home, and we're like, no, but it was just a great inspirational day to hear all the stories of individuals with epilepsy come out and tell us about it. Next, we partnered with the state office with the Louisiana Department of Health and provided rural health clinics with materials on epilepsy. And that was continued through our PCE 120 program, which is a primary care elective program that we have with the LSU Medical School in New Orleans. It's all first-year medical students get selected to do this program during the summertime in a primary care setting. So they were able to provide that information to the clinics for 4 weeks. Next was the Day with Allied Health. That is students that come in from high school level from 9th to 12th graders. And we focused on allied health, and we partnered with the Epilepsy Foundation as well. And then Day with Doctors, once again, that was high school students, juniors and seniors. We provide them education materials at the Day with Docs in New Orleans at the LSU Medical School, which is all first-year medical students as well. So we go over the training of that. We reached 875 individuals, and our goal was 548. We distributed material packets to our Ryan White food bank that we have. As an AHAP, we have to have a food bank in a rural underserved community, and we do so by providing food to the individuals. So we were able to piggyback that on as well and provide education on epilepsy, which we have 90 clients that we serve in that area. Next was our social media aspect. We had reached about 72,000 for Facebook impressions. LinkedIn impressions were around 900. Overall, we had 200,000 impressions we made through our hashtag epilepsy equity. Our CE certificate of completion for seizure recognition that we know of currently, that we have reported is 10. It's still ongoing. It is from the rural underserved areas. So in our eyes, we see that as a win because of the rural areas is so underserved, and just to provide education to them was a great need. And so we're still striving at that. Our overall results from our survey that we completed, we had 97.2 increase their education and awareness with epilepsy. The new partnerships that we were able to create because of the Epilepsy Foundation was Saving Grace Foundation, the National Pharmaceutical Association, and the Walmart Health and Wellness Day, which was through the National Pharmaceutical Association when we were with the Epilepsy Foundation this past week in New Orleans. We were able to partner with Walmart in getting a grant for this certain area of our community that's very underserved. So we just applied for that Tuesday, and they said it's looking good that we'll get the credit for funding. So that's all good. Next slide, please. So we're still going further. We have many events scheduled. Actually, today we just completed the back to school event with teachers and certification. So we're still going strong. We have an opportunity for a local rural library in Bogalusa, Louisiana, and we're going to have an epilepsy event day for back to school in the end of August. We plan to attend the National African American Male Wellness Initiative Walk in New Orleans for October. So we're excited about that. Social determinants of health meeting we do have scheduled in September for meeting our local governments, focusing on the police and fire department training. We completed the fire department training in a rural area up north Louisiana. It was a great success. They really wanted us to include more of fire departments throughout the state and look at police as well. Also, we have on the plate for a September meeting with the school board to go back to school epilepsy training for the school-based registered nurses in our school system. So we're excited about that. And overall, that made this program a success was our community partners that we have currently. Of course, Southeast Louisiana AHAC, we have many hats in the community, so it's always a good win with our other programs to piggyback. We have AHACs for a Healthy Louisiana, which is our 4 AHACs in the state. So it's an umbrella program of all 4 AHACs collaborate together. The Louisiana Department of Health, Louisiana LSU Public Health Department made this a great opportunity to share the Epilepsy Foundation materials. Our rural fire departments have gained access, piggybacking on from our CPR first aid. We also are doing the seizure first aid, Saving Grace, our health equity programs. We have Volunteers of America and Loving Arms Healthcare and the Bureau of Chronic Disease. So we couldn't have done it without our partners in the community of Louisiana. And I thank you.
Thank you so much, Liz. We're going to go on to Renee.
So great to hear all of these so far, and very glad to be a part of it. So we'll start with our slides. And as we do that, I want to begin with a word of gratitude, because we know that first and foremost, this grant initiative is set up in a way to really impact the lives of people with epilepsy and also their families, their friends, and the whole community. It's also been set up in such a way for affiliates and other organizations to be able to make these partnerships that will last in an ongoing way. And part of the reason I want to say a word of thanks is that we really have benefited from this process. It's allowed us to learn, it's allowed us to impact lives of people with epilepsy, and we have indeed created partnerships that are going to last for a long time. So much more to come. Our project objectives were to train 120 to 150 people in seizure recognition and first aid in the Upper Peninsula of Michigan, or excuse me, the Upper Lower. That's the northern region of the Lower Peninsula in Michigan and the Upper Peninsula. And we also wanted to increase knowledge and access itself to appropriate epilepsy care by introducing 200 plus Northern Michigan residents to materials about epileptologists, one who is serving in Traverse City and all of Michigan's comprehensive epilepsy centers. And then, of course, we want to create opportunities for connectional care among people, among residents of the Upper Peninsula, and to allow them to meet each other. And of course, to learn more knowledge about the Epilepsy Foundation of Michigan and our own programs and services. So I'd love to share with you what our project activities were. And then when we go to the next slide in a moment, I'll tell you some of my favorite stories and outcomes. So we had seizure recognition and first aid presentations in Traverse City. We felt that in Northern Michigan, Traverse City could be a wonderful hub for people to gather and gain knowledge. And so we had two presentations, one to a Rotary Club and another at a high school that was community-wide. And we had 60 people show up in person for that. And one of the most wonderful things for us in that experience was the recognition that the majority of those 60 people were brand new to our organization, and that in getting the word out, they were able to discover this opportunity and they came. It's wonderful. Another great thing about being a part of this initiative is learning from all of the other participants. And we did not originally have in our grant proposal to send epilepsy awareness materials to rural libraries, but we learned that from other participants and the Epilepsy Foundation of Kentuckiana in particular. So we wanted to send those, and we did. We have this big inflatable brain as an educational tool, and we took that to the National Cherry Festival in Traverse City. We did that in July, and the National Cherry Festival has become a great partner to us, and they were extremely generous in what they offered us in placement, and we were very grateful. We held meetups in the Upper Peninsula for people to meet, more about that in a moment. And through our primary partner for this project, the Center for Rural Health at Northern Michigan University, we were invited to do a webinar about epilepsy in the Upper Peninsula. And I and Tameta Cozarts joined two other people, Liz Preston, who is a young adult with epilepsy, and her mom, Kathy Agee, to speak about that. And it turned out to be very fruitful. And again, that was not written into our grant, but something that came into being as we built relationships. So we can go to the next slide, please. We had big impacts because of this project. So we were able to train 120 people in seizure recognition and first aid. As I said before, half of that took place in Traverse City, but other people from other rural counties in Michigan joined us for other trainings that we had, including 2 live ones that were done virtually where anyone could join. Here's the biggest impact, I think. You'll see that great picture of our big brain. Inside, we have signs about epilepsy. You can see all the neurons in there. People can enter and go inside and learn. And we estimate that at least 7,500 people walked through that big brain at the National Cherry Festival. You may wonder how we counted that. We did not have a counter going for each person. I think that would be a little too much for us, but we did do, occasionally we would count for like an hour at a time. And we did that multiple times to see about how many people were flowing through per hour. We actually think 7,500 is on the lower end of what happened there. One of the most wonderful things to see was that we watched parents and grandparents, aunts and uncles walk inside that brain and begin to educate their children. And it made me realize that while we were there and present to do direct education, this tool of the big brain allows people to step inside and become the educators. Now, did all of those adults know great detail about epilepsy as they were teaching? Probably not. Hopefully some of them did, but because they had those signs, they began to educate young people who were with them, and that was a wonderful thing to watch. As I said before, we had created epilepsy awareness materials and seizure first aid posters and sent those to libraries in 12 rural counties in Northern Michigan. Another one of my favorite moments is that I went to Mackinac Island as a tourist myself and just walked into the library that was there. And even though it was our team who sent these to various counties, I was surprised when I saw our materials right there presented and displayed in a very visible place. And it was very touching, not only to be able to send those, but to see that they were being used. We made a tremendous partnership with the Center for Rural Health, and that webinar that I mentioned before, people could attend that live. but also the audio of that webinar was sent to 5 radio stations in the Upper Peninsula. Very excited that that took place, and more is to come in that partnership. One of the things we realized is that our meetups were not in the most ideal places. And, we all learn as part of this process, and our meetups were not attended at all. People didn't show up. And so you try things, and it's okay to just learn. But what is wonderful is that the Center for Rural Health is inviting us to Marquette, and we are going to do a much larger first aid event in the fall. So we're looking forward to that. Thank you so much.
Thank you, Renee. All right, so now we're going to hear about the efforts that have occurred in Virginia from one of their local AHECs.
Hi, good afternoon. Thank you so much for inviting us. My name is Dina Lattimore. I'm here representing Dr. Susan Hunter, who is our interim director of our Eastern Virginia Area Health Education Center. I did want to make a note that I believe one of the first slides, it had Virginia AHEC. We're actually the Eastern Virginia Area Health Education Center. So just wanted to make a note of that. So we are a first-time grantee, and we were very excited and still continue to be excited about participating in the program. But just to give a little background, we are one of 8 area AHECs in the state of Virginia. We're funded by a federal grant from HRSA, HRSA. The mission of the EVAHEC, or the Eastern Virginia Area Health Education Center, is to provide support health education activities and services with the focus on primary care in rural communities and those health-related agencies with less access to resources, and to recruit and train and to retain the workforce needed to create a healthy Eastern Virginia. We, as a new AHEC, service about a 3,200 square foot radius and about 20% or a little over 1.7 million people in the state of Virginia, including 16 counties and cities, including Accomack, Isle of Wight, James City, Northampton, Southampton, York, and the city of Chesapeake, Franklin, the city of Hampton, Newport News, Norfolk, Poquoson, Portsmouth, Suffolk, Virginia Beach, and Williamsburg. So we have a pretty wide geography that we service. And so we can go ahead to the first slide. Thank you. So we had a couple objectives. The first was to increase awareness of epilepsy disparities and epilepsy resources among rural and multicultural communities. We target our CHWs, our community health workers, our Hispanic residents, and our African-American residents in Virginia through communications efforts. We also had an objective to increase the number of new inquiries from Virginia residents who either call the hotline number or sign up for seizure first aid or CHW epilepsy training. We had our target audience, as mentioned, is our CHWs and their advocates, our rural African-Americans, Hispanics in the communities. And some of the activities that we were able to successfully complete thus far are a series of email blasts to our CHW Alliance. And so we've had email blasts go out every other week since May. So we've been doing that pretty regularly with a lot of success as far as building awareness. We've also taken road trips to the Eastern Shore of Virginia and identified and worked with and started communicating with various rural barbershops for a barber campaign that we're doing, and also other advocates in the community. We've had a very successful urban radio or historically Black college and university radio campaign with a number of HBCU radio stations, including Hispanic stations, radio stations, and print outlets. And we've done other rural print publications and on Southampton County. So the Eastern Shore is the rural area, and then Southampton County is our second rural area. And we've had both radio and print media campaigns for both of those areas. In regards to challenges and barriers, we were intended on doing a podcast with a local neurologist, and we were able to record the podcast, but after actually listening to it, we realized that it wasn't the best interview. So we repackaged it, and we are doing articles in our local newspapers, and we are using little snippets of the podcast interview to promote the awareness of epilepsy and the resources in our rural and local areas. We also have a small challenge that we are actually working our way through when it comes to our billboard campaign. That should actually begin in the next 2 weeks and will run for 12 weeks. So it'll run throughout the rest of the month of August, but they were able to put us on the calendar for at least 12 weeks for the billboards to run for epilepsy awareness. And our rural barber campaign is actually beginning next week as well. We are providing flyers and posters and also barber capes to the local barbers in the rural areas, the Eastern Shore and Southampton County. That's going to begin very soon. We've had meetings with the barbers, and they are all excited about participating and sharing information with the gentlemen while they are in their chairs. We are working to get more collateral information so that we can hand out these posters and flyers to the barbershops and other constituents as we see them. One other activity actually that we most recently added, we are working with a couple area advocates to do a Beat the Heat campaign in this month. So we will be passing out water bottles and fans to the homeless population and also the less fortunate in our communities. And so we will also be passing out flyers and collateral material when we are passing out water bottles during these hot weeks here at the end of the summer. Next slide, please. Thank you. So our overall goal was 942,000 impressions for the media campaign, including the campaign to train CHWs on epilepsy and seizure first aid. So the goal of 942,380 has been blown out the water with over 2.4 million impressions overall with the media campaign, and also the touches when it comes to getting the trainings executed. So we have definitely done a really bang up job with getting the word out about epilepsy. Some of the radio stations that we've worked with include the local radio station here at Norfolk State University, Hot 91. We are still running and have been running paid and public service announcements throughout the entire campaign. I heard one earlier today. We have also worked with La Selecta, which is the Spanish station here in the Metro. And we've worked with the Eastern Shore of Maryland radio station and WESR, which is another station on the Eastern Shore. We've done print ads in the Tidewater Hispanic News. We're doing print ads in Tidewater, the Suffolk News Herald, and Tidewater Publications, which is, they're different publications, but they have very similar names. So those are some of the publications that we are running print ads in, and we'll continue to run publication print ads in the New Journal and Guide, the Eastern Shore Post, and continue to do social media throughout the month of August. Another thing that we are very excited about is our relationship, which is a new relationship with the Virginia Association of Free and Charitable Clinics. We are running advertisement and information in their newsletter. So as a first-time grantee, it's definitely been exciting to learn about and offer assistance to our community. We have built relationships with the local Epilepsy Foundation, and we have a number of individuals that we have worked with that have epilepsy that are willing to do testimonials, and we'll continue to build those relationships. But I would also like to say that we're excited about the possibility of working next year after having listened to all of the presentations and kind of seeing what everybody else is doing and, you know, all of the creativity. It's really got me excited about being able to do even more next year, and particularly here on the campus of Norfolk State University. So we have a lot of really talented students that would love to get involved. And so next year we're excited about what else we can do. So this year was really great, but we're looking forward to even better resources and support and information to be disseminated next year. Thank you.
Thank you so much. We are now going to go all the way up to New York to hear about what's happening there.
Great, thank you. It's interesting being from New York and being on a rural health grant. A lot of people, when they think New York, immediately think of the city. So quite a bit of New York State is not the city, and most of everything north of the city is actually relatively rural for New York State. So here at the Epilepsy Foundation of Northeastern New York, we serve 22 counties in that Northeast region, kind of bordering Vermont. So we serve 22 counties regularly, and for the purpose of this grant, we focused very directly on 4 counties in the most northern region of the state. So there's less than 200,000 individuals within those 4 counties. So hearing that last presentation having 2 million impressions is absolutely crazy. So congratulations on everybody's what they've been able to accomplish for this grant opportunity. And we are very grateful for the opportunity as well. So for the next slide, we can talk a little bit about what we had going on. So sorry for all the words on this slide, but we had a lot to accomplish, and a lot of it is still ongoing. So we created quite a few sustainable partnerships that we're really, really excited to continue with. Our first big thing was to just get the word out about what we're doing, what we have going on, who we're serving, all of our great opportunities for education and support. So our goal was to post agency information in at least 200 community organizations serving those 4 counties. This was pretty successful. We sent out a mailing to about 380 public organizations that included healthcare agencies, grocery stores, community-based organizations such as the health departments, other community health worker areas, and gas stations, including what ended up being a really fantastic partner for us, which was Stewart's, which is a very local gas station chain that has food and things like that. So similar to what Renee said, I was up in the North Country visiting as a tourist, went into Stewart's to grab a snack and saw one of our posters. And I was so excited to have been able to see that and know that there's other people in the community that will have seen that and now know what we have going on. A barrier for this was that not a lot of community organizations have bulletins, at least the ones that we sent out to. We tried to target places that would have bulletins like Stewart's, Panera. I think there was one Panera. Some of the pharmacies won't. So we did run into that where maybe the staff might have been educated, but their consumers weren't as well educated by the information. So we can't necessarily quantify. We didn't stop into all of the 380 organizations to see if they'd had it posted for the reach of that. But knowing that at least a couple of them have it up is more than we had before. Then we also did advertisements. So our goal was to reach 50,000 people via digital and print advertisements. We understand a lot of people in these regions still get a paper newspaper. So as well as engage with digital. So we wanted to kind of go both routes. So our Facebook ads were targeted very specifically again to those 4 counties. And as of about 5 minutes ago, when our lovely media girl updated our reach, we have reached 10,620 people through these Facebook advertisements and have had 328 link click-throughs to our website, which is great. That will be going for another 2 weeks, our ads, so those impressions will go up. Hopefully, and we plan to boost some of the posts to reach a broader audience as well towards the end, once we kind of get a better understanding of what our spend was. And we also had print ads run weekly in 2 different newspapers over a 6-week span. So I think that will also be wrapping up in the next 2 weeks. And there was an estimated reach between these 2 newspapers of about 49,673 individuals through home delivery services, as well as point by sale or point of sale in local businesses as well. So we definitely achieved that goal of reaching that many people through those advertisements, which is fantastic. After that, after getting the word out about what we're doing, we wanted to then serve those people with our services. So our goal was to provide training and resources to a very lofty goal of 500 people living or working in the region. That is still definitely in progress. With a ton of outreach, we had a lot of different partnerships, but the summertime was not the greatest time to reach everybody, it seemed. But we did have flyers sent through partners and e-distribution lists through those partners with regional health networks, regional childcare networks, and hospital systems, all sent out e-blasts for us regarding our seizure first aid certification training and other training opportunities that we had available. So we had 10 people educated in our targeted counties, which is a win. I know we had a pretty lofty goal of 500, but realistically 10 is great for knowing how many people actually live in those regions. And then we educated 34 in neighboring counties, because we understand that our outreach probably bleeds into the other counties as well. We do have training scheduled with the Head Start of Essex County. We have a training, I have a training tomorrow in Warren County, which is one of the neighboring, and in September again with a school district in that region as well. So again, kind of ongoing, kind of slowly getting those in. I'll also have a presentation at the Statewide Nursing Association for New York State Intellectual and Developmental Disabilities Association in September as well. So I'm hoping to reach some of the rural nursing staff in that presentation as well. So we're hoping that this fall we'll kind of continue to have more, even though this grant will be ending. All of these partnerships took some time to achieve the goals that we're hoping to. So maybe by the end of the year, we will hit that goal. Then our next goal was to interact with 105 people living with epilepsy in the region. We were able to speak with 36 people in our main targeted counties since April 1st, and an additional 27 in the direct neighboring counties to that region. So this was a total of 63 people with epilepsy that we'd interacted with, and 8 of them were new client intakes. So when a new caller calls into our agency or we're able to connect with them somehow, we will complete an intake to get their information, mailing address, to keep them up to speed on what we have to offer. Also in September 10th, we will have a walk to end epilepsy in Hamilton County. I believe this is the 4th or 5th annual of this walk, so it has been growing every year. So we're hoping to reach additional people with epilepsy in this region through different advertisements for that, as well as just it being a local event. Through all of that, we were hoping to provide 20 referrals to different services to people living within the Adirondack region. We did give 11 referrals, including those 8 new client intakes. We had a few other callers who had needs that we were able to refer them to different services. And this was able to happen through us joining a new referral network called Unite Us, which I believe one of the prior grantees had mentioned. And this has been a really great partnership for us. It is an online referral system where other care coordinators, when you submit the request, will handle the request, send it to somebody that's able to meet those needs, and get that person who's requiring these services to the service that they need within a reasonable amount of time, which is great. And we were also able to join the North Country Chronic Disease Coalition, which is a coalition of different organizations in that North Country region who actually specifically serve and offer chronic disease self-management programs. So that'll be a really great network as we move into our chronic disease self-management program, which is another grant that our agency is very grateful to have available in the fall. So that'll be another great sustainable partnership for the future. We can go to the next slide. So through doing all of that, our outcomes are some great new partnerships as listed here. These are all things that we were not aware of necessarily, or even had a great contact with for before April. So this has been fantastic. The St. Lawrence Health Initiative, the North Country Healthy Heart, North Country Chronic Disease Coalition, the Southern Adirondack Child Care Network, Adirondack Health Institute, Adirondack Regional Health Network, and 2 of our local AHECs we were actually able to get in contact with, and we do have meetings scheduled to schedule trainings in the near future as well. So we're hoping to partner with those 2 AHECs that serve that North Country region to offer more seizure first aid certification classes in the fall, which we're very excited for. So some lessons learned is that partnerships and collaboration take time, and everybody takes time off in the summer. So our goal of having a lot of trainings in the summer was a little botched. So we are very excited to start back up in the fall with all of these presentations. So we are so certain that this mini grant jump-started some really fantastic partnerships and will help us better serve our region in the future. So thank you to Meta and everybody that went into this. And then this is one of the ads that went out for our agency as well to the North Country newspapers and on Facebook.
Thank you so much. We will now hear from Tanisha.
Hello, I am Tanisha Tyler-Grace. I'm the founder, CEO, and president of When the Trumpet Sounds. And we are national, international advocates standing at the table as it deals with social determinants of health as it impacts the epilepsy community. And here recently, I have been honored to actually oversee and critique 11 grants at the federal level, dealing with the new monies that will be coming up beginning of next year for universities as well as scientists who are presenting new studies. We have actually been working on impacting the community one story at a time. So we have been actually working on storytellers platform. And right now we're working on a docuseries of true authentic stories of those who actually live with epilepsy. Next slide, please. Our community engagement has been in our outreach. Epilepsy awareness motorcycle ride, where we went to local churches throughout the Western Tidewater area, Isle of Wight and Suffolk, provided training and passing out 10 minority health toolkits with sudden unexpected death book literature, as well as epilepsy literature. We also had provided a chat and chew that Norfolk State did help us with during this epilepsy awareness ride. We also have attended Engage Norfolk, where there were actually 144 different vendors in this space. And we also had the opportunity of talking to our Congressman Bobby Scott and giving him a little training of what epilepsy looked like and what we can offer in our epilepsy training. We have also been a vendor in the Community Day Health Symposium with what is called Inner Peace Coalition. I believe that there was probably about 200 of us in this space. We actually attended a breakfast, affordable housing workshop to work on more collaboration, to actually see what was actually taking place for us in the housing community. We actually did a community fish fry partnership with First Baptist Church in Isle of Wight, where we passed out epilepsy education throughout the community at the said Community Day. Recently, I think it was maybe 2 Sundays ago, I was actually a speaker at the New Calvary Baptist Church, and we are also vendored that day, passing out 12 toolkits with seizure education. Next slide, please. We have also been able to be in an interview with For the Common Good, where 650,000 households were reached monthly. We also have done an interview with Epilepsy Gangster. We're waiting for him to actually release that footage, as well as doing an interview with Duke University on sudden unexpected death in epilepsy. And we have also become a partner with them as well. Recently, just last Thursday, we had an upcoming event There was Community Day and Health Symposium, where 104.9 FM and 92.5 FMs, what is known as Praise FM, actually had me to come on and do a live interview that reached over 500,000 individuals at the time of this present interview, where this number was still climbing and is still climbing today. And based on the response that I got back from the host, is that many people have asked for me to actually come back and speak a little bit more. So he has actually offered me a platform speaking 3 to 4 times a month, free of cost. So we talked about the health symposium. We had panelists that actually came from VCU, Dr. DeWar, Mr. Lowell Evans, who is actually part of EF of Virginia, Mrs. Council, who actually has a organization that she founded due to the loss of her child, who died from traumatic brain injury. And we also had a grief counselor, then me, myself, speaking on sudden unexpected death and epilepsy. We looked at the attendance rate of being 300 people in attendance on that day, where we did have vendors out there. So we had the opportunity to kind of talk, chat, and chew about epilepsy in ways that we can be more impactful in our community. And that day, we also passed out 30 toolkits, as well as seizure books and sudden unexpected death books as well. As I touched on, we are working on storytelling, and part of having an actual docuseries that we're actually right now working on being edited. We have been able to host 4 support groups via online, where we have one that will be coming up that we'll be actually hosting as a chat and chew. If you look at the bottom picture here, you see a young man sitting here with his grandmother and his aunt. He was actually a bishop / pastor who actually opened up our health symposium day and our community day event that we just had on August the 5th. We did have the opportunity to actually go in and meet the president of Norfolk State, and also meeting the president and the founder of the Williamsburg Community Foundation. Also having partnership with Centera Hospital, where we have just received another grant underneath their umbrella, and have also been chosen as to be spokespersons for their new cerebellar unit that will be opening up in the near future. And also a new partnership with the NASIA Foundation. If any questions, I'll be available at the end.
Thank you, Tanisha. Now we're going to hear from Mark.
Hi, thank you. And I'd like to give thanks for the grant, and also share my gratitude with the other presenters. It sounds like you're all doing really wonderful work out there. The Epilepsy Foundation of Colorado and Wyoming in our region, we are the leader in connecting, educating, and empowering to improve the lives of everyone affected by epilepsy. We've only had a real active presence in Wyoming since, well, I came on board in March 2022, and we incorporated here a year before that. But we've been making a lot of progress, and the grant has helped us also to work toward fulfilling our goals. I heard the last presenter talk about reaching 500,000 people, which is wonderful. Our state is the least populated and the 9th largest landmass. So we have just over 500,000 people in our state. But so the problem of, reaching out within a rural and frontier state can be challenging, especially, since we don't have a lot of staff members. If you can imagine me, I'm the main guy here. I have my support team up in Colorado, but if you can imagine the old time, maybe movie clips of someone handling a lot of phone calls and plugging in all of the connections. That's what I'm trying to do at my job here. But we were able to make a lot of progress with the grant and meeting our objectives. One thing that we had wanted to do was a symposium, and I say it was the first ever. A lot of whatever we're doing here in Wyoming is the first ever, because like I said, we're new to Wyoming. and I live in Laramie, Wyoming. So the symposium went really well. I had been working with a young man in Gillette, Wyoming, who has epilepsy, and he recently had RMS surgery, and he's been developing as a speaker and presenter, and he was our keynote speaker. And we also had a few other speakers and lunch, and then we had seizure first aid training. So we had 45 registered attendees and 12 community partners and sponsors in attendance, which I have to say was a good number, given our small state and our newness here. But it went really well. And so hopefully it'll be the groundwork for upcoming symposiums. We hope to do a symposium annually. And then one of our goals is to provide seizure first aid training. And we did provide a training at the symposium, and that went off really well. And then we just recently did one earlier this month, an online remote training, and we had 15 attendees for that. And then on the books, we have remote nurse training coming up for school nurses, and have made really great connections. We have a state school nurse, and I will be speaking soon with their group remotely. Continuing to promote that so that we can get as many nurses trained as possible. And then we also have an upcoming campus training at the University of Wyoming planned for SFA. And I've been also throughout this on a committee that's social determinants of health conference that's going to be in Casper in about a month. It's the Y as in WY for Wyoming, Why We All Care conference. And I'm also going to have a table there and also be a presenter doing seizure first aid training. In terms of promoting awareness, we try to find every opportunity we can to get out in front of the public. We had 2 volunteers in Gillette, Wyoming for a Wyoming Community Cares event that's sponsored by the State Health Department, and they did tabling there. We did tabling at the Power of Rural Conference here in Laramie, and also at the Wyoming Nonprofit Network Conference. And just this week, we had a volunteer attend and do tabling at the Wyoming School Nurse Network Conference in Cheyenne. In terms of outreach, it's been a goal to build stronger connections. One thing, it was mentioned, digital inequities. And I work monthly. I join a telehealth meeting remotely with people across the state as we continue to work collectively to get more people in connection with the services they need. That's a really big challenge here in the state of Wyoming. Just anecdotally, people travel often to Colorado for their services. We only have 2 epileptologists in the state. And often we have in Jackson Hole, Wyoming, doctors who fly up there occasionally from Utah, at the University of Utah Medical Center. And then people are benefiting from doing telehealth remote meetings. And recently there was someone in Casper I was working with who couldn't afford to see the doctors in their community. And I was able to connect them, however, with Cheyenne Regional Medical Hospital in Cheyenne that offers a sliding fee scale. And they were able to just start with them by doing telehealth. So it's really important. Here, we have to all band together with the nonprofit organizations and the community centers and the health providers so that we can build a robust network of people who can refer among each other and make sure that people are not falling through the cracks. So we developed new relationships with multi-sector organizations And these included Somerset Senior Solutions, Cheyenne Regional Medical Center, water, which is technological assistance for people with disabilities, Wyoming School Nurse Association, the Wyoming Department of Education, and our, one of our strongest partners, the Wyoming Institute for Disabilities, Disability Support Services at the University of Wyoming, and then reaching out to, part of our objective was to reach groups like the Food Bank of the Rockies and Interfaith Good Samaritan in Laramie, which also offers food services for low-income and poor people, Casper Meals and Wheels, and Good Samaritan of Jackson Hole, and got agreements in place so that they will refer people to us who are members of the epilepsy community. And I've shared materials for them to promote and support all the services that we offer. And finally, in staying engaged with the community, like I said, I try to find opportunities that are available, and the local hospital here asked me to join their program called Walk with a Doc. And the doctor introduced me, and I told the group there all about the services we offer. And that was a great little community event. So it's we're still in a really building phase here, but the grant has been helpful in allowing us to make those connections throughout the state and making our name known so that people come to rely on us as the best source for helping people who have epilepsy in Wyoming. So thanks again. And the next person, Tamara.
Thank you, Mark. I do not think Rich was able to join us. He, of course, is the executive director for the West Virginia Rural Health Association, so one of our partner organizations, but I do have some highlights from his grant. So if you can go to the next slide. By working with our prevalence numbers that we are aware of, in terms of roughly around 1% of the individuals in our country living with epilepsy. It was proposed that 21,000 or over 21,000 West Virginians are living with epilepsy, and that the majority of their state is considered to be rural and has rural designation. And so they cover almost the majority of their entire state as the work that they do to focus on rural health and being able to address health disparities across the board. And so they were extremely excited to have epilepsy to be a part of some new programming that they intend to offer even beyond the grant. And so we're excited to have this particular new partnership. So one of the areas that they really wanted to focus on was the aspect of targeting the rural workforce. So focusing on community health workers, as many of you do know that we do have a new on-demand course that targets community health workers and teaches them epilepsy self-management in hopes that they would be more employable in the future and be able to support some of those gaps that we know occur between the aspect of seeing a specialist or seeing a provider and then having optimal quality of life. And so using our training, they were able to work with the West Virginia Community Health Worker Consortium to be able to promote that training and then also to provide some training of their own. One of their other activities was to focus on the aspect of targeting current providers, primary providers, and then also medical residents. So working with several of the local schools that have medical schools has helped them to be able to talk about epilepsy management in a clinical setting and increase the small amount of epilepsy discussion that is actually within the medical curriculum. And then also the aspect of making sure that seizure first aid trainings and the certification program is has a constant present in their state, again, even after this particular grant. And so their executive director not only became trained himself, but he also took the training so that he could become an instructor. And so we've been supporting him in learning the aspect of being able to do that training, having more resources, and then just building his self-efficacy to be able to start providing more of those trainings in the community. His main partner here was the Partnership of African American Churches, and that has helped them to be able to spread more information around seizure first aid in the Black community within West Virginia. All right, so that is our last grantee. And so we will go to the next slide. I do want to apologize that we were not able to get the chat function to work, but if anyone does have any major questions, you are able to use the Q&A function, and then we can ask those questions to the grantees directly. Again, if you want to be connected with any of the grantees after the webinar, we can also make sure that that occurs. And then we will allow for people to type in those questions, and I will check them in just one moment. But while people are doing that, I want to say, as the coordinator of this particular program, that I am extremely impressed with all of the grantees. For many of them, as you have heard, these are not areas that they were working in before. These were not partnerships that they had pursued previously. And so having the aspect of dedicated time, some resources, and then mainly just the support. I think the peer support has been incredibly important, as you've heard, that they've really learned a lot from each other, let alone the aspect of the national partners that we've been able to work with. And I want to thank our national partners in providing technical assistance for this program, especially the National Digital Inclusion Alliance, for the aspect of helping us to be able to learn from some of those rural libraries in terms of how we actually can engage them, and the health hubs that do exist in those particular facilities that we can use as other resources for being able to make sure that there are epilepsy resources in communities that, again, we may not have been previously targeting. Want to continue to thank the National AHEC organization and the National Rural Health Association for continuing to support us at the national level and connecting us at the local level. I want to make sure that I remind everyone who is on the webinar, especially if you are an affiliate or one part of our regional team that was not funded, to continue to work in these areas, even without the support of the grant, and know that at the national level and in terms of my programming, that's my job, to help you, to support you to do this kind of work. So if this is something that you're interested in, even beyond the grant, or if you want to be connected to any of the grantees to be able to find out how they did what they did, please do let us know. Okay, I do not see any questions as of yet, so we're going to go on with our last announcement. So as everyone knows, again, as our programming focuses on social determinants of health, we do make sure that we provide more opportunities for individuals to learn about those determinant areas and to learn about how they can work with certain partners to be able to address those areas. As you also know, that our cooperative agreement is a 5-year agreement, and we will be starting our next year on October 1st. So we'll be turning our attentions next year to look at public safety, and to look at how we can have better engagement with law enforcement officers, correctional officers, and those who are working in the criminal justice space. So we invite all of you to consider attending Public Health Institute. This will be the first time we'll be having this particular conference in person in 3 years, I should say. And so we are going to have it hybrid. So if you're not able to join us in Atlanta, we will have some sessions that will be able to be seen via Zoom. But if you are interested in coming in person, we would love to have you there. We are going to highlight the resources that we actually do have at the national level, such as our Epilepsy Legal Defense Fund, but then some of our new resources that we will be relaunching, such as our law enforcement training. And we are inviting individuals to become instructors for that course, so that they can continue to do that particular work at the local level that we're going to be discussing at the national level. The Public Health Institute will also be an opportunity for people to be able to work with different partners and learn how to engage them, but also be able to hear from individuals living with epilepsy who may have experienced discrimination or had not the most positive interaction with law enforcement. This is one of the reasons why we want to make sure that we can be advocates and that we know our clients' rights so we can help and support them. So if you're interested in coming to PHI and you are one of our affiliates and you need a travel stipend to help and support you to do that, please do contact me. Registration is free and everyone is welcome to join us. And we also will have more information about there being funding for individuals who are interested in becoming an instructor for the law enforcement course. So that particular training will occur on November 10th, right before PHI. And we will have more opportunities to be able to have people to attend that and have some travel support. So please look out for the announcement about that. But if you're interested in pursuing those social determinants of mini grants that will be coming out, this will be the focus. And so just as we've asked these grantees this year to focus in on rural areas, we will be looking for mini grantees to help us to be able to work with more law enforcement and criminal justice workforces at the community level and be able to implement this course. And that will be a large part of the mini grants. So if you already have established relationships with law enforcement officers, that is great. But if you do not, think about the aspect of engaging them so that when this announcement does come out for these round of grants, that you will be ready. Okay, so we are up on 3:30, and so I want to make sure I continue to express my gratitude to all of the grantees because the work that you guys are doing hopefully will be able to change part of your organization so that this is a part of the culture of the work that we do, and that even beyond these grants, we can start seeing some impact, not just in the physical health of our clients, but also the aspects of what makes up their daily life and the journey that they have to be able to have optimal health. So with that, we're going to go ahead and stop the recording. And I'm going to tell everyone, have a wonderful day and thank you again.